morning, Marie and Charles. Today I'm just going to run through the brief setup of the Hamilton and the high flow that the RFDS use on the aircrafts for retrieval of patients that require the high flow nasal oxygen therapy during transfer. To start with, I'll just run through the equipment that is required to commence this therapy. So you'd need the Hamilton monitor, Hamilton ventilator for the transfer. You'd also need oxygen, so whether that be portable oxygen or the oxygen on the aircraft. Each aircraft that we use does have the high flow bag as well, which is up the back. So it's generally the blue bag, and that contains most of the equipment that you do require apart from the Hamilton to commence the high flow oxygen therapy. I'll just run through what is in the bag, so what also is required. So for my flight nurse, they'll need one of these, which is the RT024, which is the dry extension kit to commence that, as well as we've also got two pieces of equipment, which is for the adult or the pediatric patient. So we've got the RT203, which is the humidified line used for the high flow, and that is used for the adults. And then we've also got the pediatric patient high flow line, which is the RT330, which is more for patients requiring flow rates under 25 litres per minute, where the adult is over 25 litres per minute. In each of the high flow bags as well, you'll find multiple sizes of nasal prongs. So we've got multiple sizes of pediatrics, goes from like extra small up to extra large, as well as there's a small, medium and large nasal prong cannula for the adult patient as well. In the high flow bag, there is generally some guidelines in there which do assist you in setting up the high flow, as well as choosing the appropriate size nasal cannula, more so for your pediatric patient, because it does go on the flow that they require, as well as their weight as a guideline as well, to determine the appropriate size nasal prong for them. And it also has on the back just a guideline. You don't want to include the knee, you don't want to cause pressure areas or anything like that. The other important piece of paperwork in there is a piece of paper that will help you assist in calculating how much oxygen you require for the transfer. It is important that we have a buffering and an overlap of O2 due to any chances of coming across any delays or anything like that. So I'd ensure that my flight nurse knew about this and the importance of having, I guess, full oxygen prior to leaving, and just checking that you have got enough to complete the transfer. And it just runs through down the bottom each aircraft and how much oxygen each aircraft is able to carry. Otherwise, if I didn't mention already, oxygen, as well as the humidifier itself with the thermometer cables, this is kept in the high flow bag, so generally if you've got that, you're safe. Just keeping in mind the humidifier doesn't actually work without a power source. So if you're travelling in the aircraft, we have got the 240 volt inverter, so it can run on that, as well as if you're in any QAS vehicles as well, they've got that. So just ensuring that that's turned on. Otherwise it's just delivering oxygen at a high flow, but it's not actually humidified. Otherwise I will run through the setup and how to do the pre-op test, and just if you've got any questions, I'll feel free to answer them at the end. Thank you. Okay, we're back. So next we're just going to run through just doing the high flow pre-op test. So what I will do initially is get the RT024 circuit and put that on the Hamilton ventilator. So you just connect to that, to the inspiratory port, and then we're going to turn the ventilator on with the on button. So this is a pre-op test. This should be completed before commencing high flow, just to ensure that your Hamilton monitor is working appropriately and it has, I guess, that flow rate. So it'll do its own pre-op checklist. So So we'll just wait for that to do that. And then once it's on the front screen, you can either do the pre-op check that way with the pre-op check button, otherwise you can go to system, and then there's test and calibration. And from there, we just want to do the top one, which is called the tightness test. The machine does talk you through it, but generally you'll need a gloved hand, so what we do is press tightness. And then it'll talk you through, so disconnect the patient, tighten the patient system. So with your gloved hand, you just want to occlude the end of that tubing. It's just doing the manoeuvres now just to test, and then it says connect the patient. And what we want is the green tick and the date. So it has passed its tightness test today. So this machine is able to be used for high flow. So next I'll run through the setting up of the high flow. I'll run through the setup for the use of the high flow using the Hamilton in preparation for my flight nurse to go retrieve the patient. So for the purpose of the video, and generally when you're setting up the high flow, you'll plug it in initially. However, don't turn it on because it isn't finished the complete setup. So only turn it on once it is fully set up. I've also connected the Hamilton to some oxygen for the video and just for showing you guys today. So now that we're ready to set it up, we need the pack, which we would open depending on if you got the pediatric patient or the adult patient. You decide which one you need, and so today we're just going to use this demonstration one. So to pop it into the humidification chamber, you press the blue button down and it generally just slides on. Perfect. Once that slides on, what we'll do is we'll add some sterile water into the chamber. So you don't want to overfill it. It has got the blue mark there, so generally no more than that. So you just pour a bit of sterile water in there, and this is what humidifies the oxygen. I'll just pour a little bit in. And this is all in the high flow pack as well. Since we've done the pre-op test earlier today, we'll connect the dry line to one side of the chamber, and then to the other side of the chamber is where you connect the patient line. So that just clips on there. Perfect. In the high flow pack, we have the blue line, which is the temperature probe, as well as the yellow line, which is the heater probe. So initially we'll do the blue line. So on the side of the humidifier, you've got a yellow and a blue attachment. So the blue goes to the blue and the yellow goes to the yellow. And then the way I remember this is if you look at the patient line, it's got some things, attachments for the temperature line, and it's also got this one close to the humidification has a bit of like a jagged edge, and one of the temperature probes also has like a jagged edge, and that's how I remember where they go. So that just clicks in there to secure it, and then we've also got one more which you want to attach to the patient line as well. So once that one's connected, then you can move on to the yellow one, which is the heater line. So same again, just to the side of the humidifier, yellow to yellow. If I can get it in. Doesn't want to go. There we go. That's gone in now. And then with this one, it's also got a 2-prong and a 3-prong. It does say in the policy, and it actually comes up an error if you use the wrong one. I found it's easy to tag the one that you don't use, and this one is cabled up. So you use the 3-prong one, and that just connects into the back of the humidifier, where it keeps that temperature. So that connects in there to the humidifier. Okay, the setup is almost complete. The only other thing that you need from here on is appropriate sized nasal cannula for your patient. Just for demonstration purposes today, I've just got some pediatric ones. So once it's all connected up, ultimately what we'll do is switch on the humidifier. It will come up in invasive mode, generally that's what it reverts to. It does take a few minutes to warm up, so just keep this in mind. If your patient's already on high flow, leave them on that until you've got this set up. So that'll do its little test. So we've got the top one, which is invasive, which it ultimately diverts to, and the bottom one is non-invasive. So once that's done, we'll let it warm up. And pretty much the last thing to do is, once it has warmed up, is pretty much set your high flow rate. So what we would do is we'd go to modes on the monitor. Down the bottom here it says high flow. We'd commence that, we'd confirm, and then depending on what your patient requires, how many litres per minute, we'd alter that. Generally it's 2 litres per minute for the flow, and the FiO2 we can put up or put down, depending on what the patient requires. So once that's done, and then you just press confirm, and then start therapy. So you have this on your patient and it would start. And that's quick setup for high flow. I'll be around to answer any questions if you have any.